Hi everyone, my name is Dumisom Towosis Ispanda. This is my short report on chronic inflammation. I hope you enjoy and learn something. First, let's define what inflammation is. Inflammation is a local response of living vascularized tissue to endogenous and exogenous stimuli. The term is derived from the Latin inflammare, meaning to burn. Inflammation is fundamentally destined to localize and eliminate the causative agent and limit tissue injury. Now, we've got acute inflammation and chronic inflammation. Acute inflammation is an immediate and early response to an injurious agent, and it is relatively a short duration, lasting for minutes, several hours, or a few days. And chronic inflammation is a prolonged inflammatory process where the body's white blood cells attempt to repair the body's tissues and fight the foreign invading pathogenous agents which may be trying to harm the body. This can last for as little as a few weeks, a couple of months, or even years. On this report, we'll be focusing on chronic inflammation. Now, what are the causes of chronic inflammation? Firstly, we've got persistent infections. Certain microorganisms associated with intercellular infections such as tuberculosis, leprosy, and certain fungi have a tendency of influencing chronic inflammation. These microorganisms are of low toxicity and evoke delayed hypersensitivity reactions. Secondly, we've got prolonged exposure to non-degradable but partially toxic substances, either endogenous lipid components which result in atherosclerosis or exogenous substances such as silica and asbestos. Thirdly, we've got progression of acute inflammation. Acute inflammation almost always progresses to chronic inflammation following persistent suppuration as a result of uncollapsed abscess cavities, foreign body materials, sequesterum in osteomyelitis, or a sinus or fistula from a chronic abscess. Fourthly, we've got autoimmunity. Autoimmune diseases such as rheumatoid arthritis and systemic lupus erythematosus are chronic inflammation from the outset. Now, what are the cells associated with chronic inflammation? We've got monocytes and macrophages. These two are the prima donna in chronic inflammation. Macrophages arise from the common precursor cells in the bone marrow, which give rise to blood monocytes. These cells are diffusely scattered in various parts of the body. In the liver as camphor cells, spleen, the lymph, in lungs, in bone marrow, in the brain, in the skin as Langerhans cells, the list goes on. These cells constitute the mononuclear phagocytic system. Macrophages are scavenger cells of the body. That's one thing we should always remember. Now, there are other cells that are also associated with chronic inflammation, which are lymphocytes. Now, the lymphocytes are primarily involved in cellular immunity with lymphokine production, and they are the key regulator and effector cells of the immune system. Secondly, we've got B lymphocytes and plasma cells. These produce antibody directed either against persistent antigen in the inflammatory site or against altered tissue components. Now, lastly, we've got mast cells and eosinophils. They appear predominantly in response to parasitic infestations and allergic reactions. Now, chronic inflammation has different characteristics compared to its twin brother, acute inflammation. Now, as far as duration is concerned, acute inflammation has a short duration and chronic inflammation has a relatively long duration. Now, the predominant cells associated with acute inflammation are neutrophils and lymphocytes. The ones associated with chronic inflammation are macrophages and plasma cells. Now, their inflammatory reaction is also different. Acute inflammation is exudative and chronic inflammation is productive. Chronic inflammation can be classified into the following two types based on histological features. Firstly, we've got non-specific chronic inflammation. Now, different irritants produce inflammatory reactions of the same microscopic picture. Now, for example, chronic abscess and chronic tonsillitis. Now, secondly, we've got specific chronic inflammation. Each irritant or microorganism produces a characteristic microscopic picture called granuloma, for example, tuberculosis, bilharzia, and leprosy. There are two types of granulomas which differ in their pathogenesis. Firstly, we've got foreign body granuloma. These granulomas are initiated by inert foreign bodies such as talc, sutures, fibers, and the list goes on, that are large enough to preclude phagocytosis by a single macrophage and do not incite an immune response. Secondly, now, immune granuloma are caused by insoluble particles, typically microbes that are capable of inducing a cell-mediated immune response. Thank you everyone for listening to my report. I hope you learned something. God bless you.